My name is Mary, and my presentation will be on phantom limbs. The subject comes from Chapter 14 on pain in our textbook. A phantom limb is one that can be felt after it has been amputated. This does not occur with any specific situation. Amputations can be from injury, disease, or situations like war. The feelings that can be felt make it feel like the limb is still present on the body. Not only do people get this sensation, but people can feel intense pain in the area that was amputated. According to our textbook, people who experience a phantom limb have been known to try to use these limbs to do things like getting off of a bed. An example of someone who has experienced the sensations of a phantom limb is a woman named Lynn Ledger. Her arm was amputated because her body did not react well to treatment on a tumor that was in her arm. According to her experiences, she said that it can be explained by imagining that you are wearing a lady's evening glove that stretches from fingers up the arm past the elbow. But everywhere the glove covers, it's as if it's constantly crushing your arm. There are also shooting pains and intensely painful burning sensations that come and go, but the crushing pain is constant. The concept of phantom limbs was first discussed by a man named Ambrose Paré in 1552. The most common experiences of a phantom limb back then was from war veterans who had lost a limb due to injury in battle. Ambrose, a French surgeon, performed on many soldiers and saw the condition firsthand. This was later researched by a scientist and mathematician named René Descartes and other various people who looked at soldiers coming from the American Civil War. William Porterfield was the first scholarly person to document the first-hand experiences of phantom limbs. He was also the first to consider sensory perception as the reason for the syndrome's occurrence. The sensations and feelings that people with phantom limbs can vary from mild to debilitating. The most common is the sensation that the limb is still attached to the body, but pain is still very common. Like Lynn said, the pain can be excruciating. People can feel things such as cramping, shooting, stabbing, and burning where the limb is no longer. These sensations and pains can sometimes disappear on their own. Because phantom limbs are not fully understood yet, there are not medications to cure the condition. There are many medications that can help the sensations. Medications like aspirin, benzos, and antidepressants can make people more comfortable as they live with the syndrome. There are certain medications that can be used before an amputation so that the development of this condition can be prevented. Phantom limbs are still not fully understood in science today. There are theories that attempt to explain why the condition occurs. Originally, the pain was thought to have been caused by nerves that are still intact after an amputation. This was proved wrong when pain remained after those remaining nerves were cut. The pain may occur because of the brain attempting to rewire nerves that connect to the spinal cord. Because of this, pain signals are sent because the body knows something has changed and is wrong. The concept of the brain being able to rewire is called neuroplasticity. Specifically, the term map expansion neuroplasticity fits the condition best. This means the map in the brain is still accessing the parts of the phantom maps. Phantom limbs are either treated through therapy or medication. Medications can make people more comfortable, but it cannot cure the condition. These medications range from everyday painkillers to prescriptions such as anticonvulsants and opioids. Other forms of treatment include mirror therapy, virtual reality therapy, acupuncture, and massages on the residual limb. Mirror therapy uses mirrors to show an image of the limb that is still intact. By doing so, it can trick the brain into thinking that the phantom limb is actually still present and healthy. Virtual reality does a similar thing and projects a virtual limb to trick the brain into believing the limb is still there. Acupuncture has helped many people, but not as much as the other forms of treatment. The goal of it is to balance energy flow with needles. For phantom limbs, it can reduce pain. Massages have a similar approach by stimulating the nerves and calming the pain. The sensations of phantom limbs are not just random. Doing specific things can actually trigger the pain. Things simple as touch can make it start immediately. Activities like smoking and urinating can also cause the pain. I wanted to include some random facts about the phantom limbs. This is a very common thing that occurs after amputation surgery. Over 60% of amputees will experience the sensations or pain. The condition doesn't happen immediately after amputations. It can happen right after surgery or even months and years after it has occurred for an amputee to experience it. These experiences are not common within children under the age of 4 that are amputees.